the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 milligrams, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. An unresponsive casualty, you may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 milligrams of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/.
To bandage somebody's hand, use a roller bandage. Place the bandage on the inside of the wrist, just below the thumb. Wrap the bandage straight around the wrist twice. Then wrap the bandage from the inside of their wrist diagonally across the back of their hand up to the nail of their little finger, straight across underneath the fingers, and diagonally back across the back of their hand to the outside of their wrist. Pass the bandage under their wrist and repeat, diagonal over the back of the hand, across the fingers, and back again. Keep going the same way, bandaging diagonally across the hand like a figure of 8. But each time, only cover about 2/3 of the previous layer. Each new layer should be covering 1/3 of new skin. Make sure you leave the tips of their fingers peeking through. Once you've covered the whole of the hand, wrap the bandage straight around the wrist a couple of times and secure with a pin or tape. To check the circulation, squeeze the fingernail for 5 seconds. When you let go, if the colour doesn't come back within 2 seconds, it means the bandage is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, when applying a hand bandage, use a roller bandage. Make sure the bandage extends far beyond the injury site to ensure an even pressure is applied to the wound. If someone sprained an ankle, knee or elbow, you can use a bandage to support the limb. To make sure you give the right kind of support, bend the joint slightly and apply an ice pack and padding, and then a bandage to help cool and support the injury. You need to wrap it either side of the injury too, to give enough support for the whole area. We're going to demonstrate this technique on an ankle, but you could use it for an elbow or a knee. To bandage an ankle, use a roller bandage. Make sure you have the ankle raised and supported to start with, and then apply an ice pack and some padding. Using the roller bandage, start with the tail and put it to the inside of the foot, and then wrap it around 1.5 times just to make sure that it doesn't come off. I'm just going to lift up your leg a little bit. Okay. It's important to bandage from the toes to the knee because you need to make sure that you cover from the joint before to the joint after the injury site, and then just keep on going around and around. So keep on going until you get to the knee. And then if you can, wrap the bandage around twice when you get to the knee, and then just pin it in place. Does that feel okay? Yep. To check circulation, squeeze the toenail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the bandage is too tight and you need to loosen it off and reapply it. Keep checking the circulation every 10 minutes because the ankle may still swell. So remember, when you're bandaging a sprain, apply an ice pack and then cover the injury with padding. Apply a roller bandage to hold the ice pack and padding in place and to help support the injury. Check circulation every 10 minutes and keep the injury elevated. And that's how we bandage a sprain.
If after performing a primary survey, you find a child who is unresponsive and not breathing normally, call for help. Ask someone to phone 999 or 112 and ask them to bring an AED if one is available, while you begin CPR immediately. If you're by yourself and do not have a speakerphone, start CPR with 5 initial rescue breaths, then 30 chest compressions and 2 rescue breaths for 1 minute before calling for help. To give rescue breaths, open the airway by tilting their head back with 1 hand on the forehead and 2 fingers under the chin. Pick out any obstructions from their mouth to clear the airway, only if you can clearly see something. Keeping their head in this position, pinch the soft part of their nose, allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 5 initial rescue breaths at about 1 breath per second, like this. To do chest compressions, kneel down by the child beside their chest. Place only 1 hand on the center of the chest. Lean over the child with your arms straight and press down vertically 1/3 of its depth. Release the pressure, allowing the chest to come back up without removing your hand from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast, and to help you, you can sing Nelly the Elephant, which can help you to keep up with the pace. After 30 chest compressions, open the airway and give them a further 2 rescue breaths. Continue to alternate between 30 chest compressions and 2 rescue breaths until help arrives. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get a telephone, take the child with you if you are able. Do not leave the child to look for an AED. The emergency services will bring one with them. If there's someone there who can help, if they have brought an AED, ask them to turn it on and follow instructions while you continue CPR. If they can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruptions to chest compressions. Continue CPR until emergency help arrives and takes over. The child starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally again, put them in the recovery position. So remember, if you come across a child that's unresponsive and not breathing normally, call for help. Tell a helper to call 999 or 112 straight away and ask them to bring an AED. Give 5 initial rescue breaths, Then 30 chest compressions followed by 2 rescue breaths. Continue giving 30 chest compressions to 2 rescue breaths until help arrives or the child starts to breathe. And that's how we perform CPR on a child. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate. If after performing the primary survey, you find someone who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand center on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing "Staying Alive." After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there's someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally, again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask a caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk if you found someone collapse. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response, you can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the AVPU scale, and each letter can represent the casualty's level of response. A, alert. V, response to voice. P, response to pain. And U is the casualty unresponsive to stimuli. If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway, it is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. Call for emergency help. Call 999 or 112. And that's how we perform a primary survey. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
If you ever find your baby is not responding to you, you will give them the best chance of survival if you know what to do. If you have found your baby unresponsive and not breathing normally, you will need to perform baby CPR. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help. Do CPR for a minute before calling for emergency help. Give 5 initial puffs covering both the nose and mouth, then 30 chest pumps with 2 fingers to the centre of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you do baby CPR. Thanks for watching. Help support St John Ambulance. Donate today.
You should use a sling to stop someone's arm moving to protect it and prevent further damage. There are 2 types of sling, an arm sling and an elevation sling, and both can be made using a triangular bandage. The difference between these 2 types of sling is that an arm sling holds the arm in a horizontal or slightly raised position. It treats upper arm injuries, wrist injuries, somebody who can bend their elbow, and also for a rib fracture. An elevation sling holds the arm in a raised position with the fingertips touching the shoulder. It can help support the arm. It can also help control bleeding from the hand or the arm and also help to reduce swelling. To make an arm sling, ask the casualty to support their arm. You just hold it for me. And then use your triangular bandage and gently pass it underneath their arm and over their shoulder. And leave the long bit facing down. Then bring the top bit around to the opposite shoulder, and the bit that's hanging down, bring that up to beat it. If you just let go of your arm for me now, and then re-support it. Lovely. Just tie a reef knot. And then tuck the corners underneath. And make sure the whole of the arm is supported, down to the little finger. With the bit that's left over, just twist it until it becomes nice and tight and it snugly fits in around the elbow. To make an elevation sling, first ask the casualty to support their injured arm. You just support it there for me, and their fingertips should be touching the shoulder. Lay your triangular bandage over the injured arm. Just get the casualty to hold it in place. Just hold it there for me. Come underneath the arm, around the back, and then tie using a reef knot. And then just tuck the points under. And tight, and it fits snugly in by the elbow. To check circulation, you need to squeeze the fingernail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the sling is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, there are 2 types of sling. You need to know which one to use for each condition and how to apply them.
When there's something wrong with your baby, if you know what to do, you'll give them the best chance of survival. If you have found your baby is not responding to you, you'll need to do a primary survey. If they are breathing, try to keep calm and put them into the recovery position. This is the safest position for your baby until help arrives. Cradle your baby in your arms with their head tilted downwards. Then call for an ambulance. Keep checking your child's breathing, pulse and level of response while you wait for help to arrive. And that's how you put a baby in the recovery position. Thanks for watching. Help support St John Ambulance. Donate today.
Shock happens when the important organs in the body, such as the heart and brain, don't get enough blood or oxygen. Your baby can suffer from shock if they've lost a lot of bodily fluids. This could be from diarrhoea, vomiting, burns or dehydration. Your baby may also suffer shock if they have had a severe allergic reaction, a severe infection, or if they are bleeding heavily. If your baby is in shock, you might see some of these signs. They may look pale and unwell. Their skin may be cold and clammy. Their breathing may be fast and shallow. They may not be feeding or urinating. They may make a grunting noise when they breathe, or they may yawn or sigh a lot. They may appear confused and not respond as normal. In severe cases, they may become unresponsive. If you think your baby is in shock, call 999 or 112 for an ambulance. Explain that your child is in shock and what you think caused it, such as bleeding, diarrhoea, vomiting or an allergic reaction. Lay your baby down with their legs raised higher than their chest. Support the legs on something like a cushion or a rolled up blanket. Do not leave your baby on their own. Loosen any tight clothing around their neck, chest and waist. Keep your baby comfortable and calm, as fear or pain can make shock worse. Keep checking your baby's breathing and pulse and whether they can respond to you. If they become unresponsive at any point, open their airway, check their breathing and prepare to do CPR if necessary. So remember, call 999 or 112 for an ambulance. Keep your baby's legs raised above their chest. Keep them calm and comfortable. Keep checking their breathing. And that's how you treat a baby for shock. Thanks for watching. Help support St John Ambulance. Donate today.
Cracking a bone is called a fracture. A broken bone that does not puncture the skin is called a closed fracture. But sometimes a bone can puncture the skin. This is called an open fracture. Even if you can't see any blood, the break will have caused some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bones, are supple and can split, crack or bend quite easily, a bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They may have difficulty moving and have movement in an unnatural direction. The limb may look shorter, twisted or bent. There may be a grating noise or feeling if the limb is moved, have loss of strength or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area, use a sling or triangular bandage to keep it secure, cover any wounds, call 999 or 112. And that's how you treat someone with a fracture. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/.
Sunburn is caused by overexposure to the sun, a sun lamp, or overexposure to radioactivity, although this is extremely rare. We can avoid overexposure by covering the skin with clothing and wearing sun cream. If you think somebody may have been sunburnt, there are 3 things to look for: reddening of the skin, pain in the area that's been burnt, and blisters. Encourage them to take sips of cold water, cool the area down by sponging them with cool water, or soak the sore skin in a bath or a shower for no longer than 10 minutes. You can repeat this if it helps ease the pain. If the burn doesn't blister, then the sunburn is mild and you can treat with calamine lotion or after sun to soothe the sore skin. If there are blisters or other skin damage, then the burn is severe and they will need to see a doctor. You will also need to look out for symptoms of heat stroke and heat exhaustion, as these can be life-threatening. Remember, cover the skin, take sips of cold water, cool the skin. If there's no blistering, then use calamine lotion or after sun. If there is blistering, seek medical advice. And that's how we treat somebody who's suffering from sunburn.
In an asthma attack, the muscles of the air passages in the lungs go into spasm. This makes the area narrower, making it difficult to breathe. This can be triggered by an allergy, a cold, or smoke. At other times, someone may have a sudden attack with no obvious trigger. If you think someone is having an asthma attack, there are 5 things you may see. They may have difficulty breathing or speaking, they may be wheezing, they may be coughing a lot, they may be distressed, anxious, they may have a grey-blue tinge to their lips, the earlobes, or the nail beds. People with asthma usually know how to deal with their own attacks by using their reliever inhaler, usually with a blue cap at the first sign of the attack. But if they don't, or if the attack is severe, you may need to help. When treating someone having an asthma attack, keep calm. Reassure them and advise them to use their reliever inhaler straight away. Advise them to use a spacer if they have one. Amy, use a spacer with the inhaler. Yes. Yeah, well done, well done. Ask them to breathe slowly and deeply to help control their breathing. Sit them down in a comfortable position. If it doesn't get any better within a few minutes, it may be a severe attack. Get them to take 1 or 2 puffs of the inhaler every 2 minutes until they've had 10 puffs. If this is their first attack, the attack is severe, they're not getting better, they're getting worse, or they become exhausted, call 999 or 112 for emergency help. Help them to continue to use the inhaler as needed. Keep checking their breathing, pulse, and level of response. If they do become unresponsive at any time, treat a casualty who is unresponsive. So remember, reassure them. Help them to use their reliever inhaler. If the attack is severe, call 999 or 112 for emergency help and monitor their level of response. If they become unresponsive, treat as an unresponsive casualty. And that's how we help someone with an asthma attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate. Eye injuries vary from something very minor, such as getting shampoo in your eye, to something quite serious, such as a cut, which could cause permanent loss of vision. Common types of eye injuries include foreign objects getting stuck in the eye, cuts or grazes from a sharp object, severe blows to the eye from a hard object. If you think someone's hurt the eye, there are 5 key things to look for. Pain in the eye or eyelid, a visible wound or bloodshot appearance, partial or total loss of vision, blood or clear fluid leaking from the wound, screwed up eyelids and watering if there is something in there. If someone has an eye injury, tell them not to rub the eyes as this can make it worse. Get them to sit down facing a light. We're going to open the eyelid. Get them to look right, left, down, and back. If you see something in the eye, get them to tilt to the injured side. You can use a jug of water or saline solution to remove the object. You can use a tea towel to get any drips that may come from the eye. If you think the eye may be bruised or cut, get them to lie on their back, keeping their head and eye as still as possible. You can give them a non-fluffy sterile dressing to hold in place over the eye. Mark, could I get you to just place this over the eye for me? Excellent. Or you can keep it in place with a bandage. Then take or send him to hospital. So remember, when you're treating eye injuries, Tell them not to rub their eyes. Look closely to see if there's anything in the eye. If there's something in it, wash it up with clean water. Put a pad on the eye if it's bruised or cut, and take or send him to hospital. And that's how you treat.
Cuts and grazes are common injuries that can usually be treated at home. A cut is a full break to the skin, whereas a graze is just the top layers of skin being scraped off. Normally, all you need to do is clean and dry the cut, apply some pressure and raise the injury. This should help prevent infection and stop bleeding. The wound should heal by itself within a few days. When treating a cut, always wear gloves if you have them, and first ask the casualty to apply some pressure to the wound using a piece of gauze. Just put some pressure on there and then raise the injury. Next, you need to clean the wound. And gently dry it. And finally, apply a sterile dressing. Just remove the gauze. Brilliant. Remember, apply pressure, raise the injury, clean and dry the cut, apply a sterile dressing. If you're worried about infection, ask the casualty to seek medical advice. And that's how we treat a cut or a graze.
Dehydration occurs when the amount of fluids lost from the body is not adequately replaced. It is mainly the result of excessive sweating through sporting activity, hot temperature or fever, but can be caused by diarrhea and vomiting. There are 4 signs of dehydration to look for: headaches and lightheadedness, dry mouth, eyes and lips, small amounts of dark urine, muscle cramps. If someone is dehydrated, help them to sit down and give them plenty of water to drink. Giving them an oral rehydration solution to drink will help replace the salt and other minerals which they've lost. You can buy rehydration sachets from the pharmacy. If they have any painful cramps, encourage them to rest and then help them stretch and massage the muscles that hurt. Keep checking how they're feeling. If they still feel unwell once they're rehydrated, then encourage them to see a doctor straight away. So remember, when you're treating dehydration, help them to sit down, give them water, give them an oral rehydration solution, encourage them to see a doctor if it doesn't go away. And that's how we treat dehydration.
If you think someone has a fever, there are 6 key points to look for. To start with, high temperature, above 37 degrees Celsius, pale skin. They may feel cold with goose pimples, shivering with chattering teeth. Later on, hot flush skin and sweating, headache and general aches and pains. Take their temperature using a thermometer. If it's above 37 degrees Celsius, it's a fever. Give them plenty of cool drinks to replace any fluids they lose from sweating. If they are feeling unwell, you can give the recommended dose of paracetamol. But remember, don't give any aspirin-based product to anybody under the age of 16. If you are worried about their condition, then call their doctor's surgery for some advice. If their temperature is above 39 degrees Celsius, then call their doctor or the NHS advice line. If their condition worsens, then call for an ambulance immediately, and if it's a child, be prepared to treat them for a seizure. Remember, check their temperature, keep them cool, give plenty of cool drinks. If their temperature is over 39 degrees Celsius, seek medical advice, and if their condition worsens, call for an ambulance. That's how we treat a fever.
Frostbite happens when parts of the skin and other tissues freeze due to low temperatures. It usually happens to parts of the body furthest from the heart, like fingers and toes. Frostbite usually happens in freezing or cold and windy weather. People who cannot move around are more likely to get it. Someone with frostbite will probably have hypothermia, so be prepared to treat them for hypothermia too. There are 4 signs to look for: pins and needles to begin with, paleness followed by numbness, hardening and stiffening of the skin, change in skin colour, first white, then blotchy and blue. If someone has frostbite, encourage them to put their hands in their armpits, then help move them indoors or somewhere warm. Then gently remove any constricting items like rings, gloves or boots. Also remember to keep them warm. Next, warm the body part with your hands on your lap or under the armpits. Don't rub because it could damage the skin tissue. But if there's a danger of it refreezing, don't warm it up yet as it could cause more damage. Place the body part in warm but not hot water that's around 40 degrees centigrade. That's 104 Fahrenheit. And be careful not to put it near direct heat as this could cause more damage. Dry it carefully and put on a light dressing, ideally gauze pad from your first aid kit. Once you've done that, help them to raise their limb to reduce swelling. You could use a cushion or sling. You can give them some painkillers for the pain, then take or send them to hospital, but make sure their affected limb is raised. So remember, when treating someone with frostbite, put their hands in their armpits, remove restricting clothing, warm the body part with your hands, use warm water but not hot water to warm the affected limb, put on a light dressing, give them painkillers caused by loss of salt and water from the body, usually through excessive sweating. It develops slowly and usually happens to people who aren't used to hot, humid weather. A dangerous and common cause of heat exhaustion is when the body produces more heat than it can cope with. This can happen when someone takes non-prescription drugs, like ecstasy, which can stop the body from regulating its temperature properly. There are 6 key things that may lead you to suspect someone has heat exhaustion: a headache, dizziness and confusion, a loss of appetite and feeling sick, sweating with pale, clammy skin, cramps in the arms, legs and stomach, and fast, weakening pulse and breathing. If you think someone is suffering from heat exhaustion, help the person to a cool place and get them to lie down with their legs raised. Give them lots of water to drink, and you can also give them an isotonic drink to help replace the salt in the fluid that they have lost through sweating. Keep checking their level of response. If their condition seems to be getting worse, place them into the recovery position and call 999 or 112 for emergency help. So remember, help them lie down in a cool place, raise their legs and give them water to drink. And that's how you treat someone with heat exhaustion. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/.
Heat rash or prickly heat is an itchy rash of small red spots that can cause a stinging or prickling feeling on the skin. The rash can be anywhere on the body, but usually people get it on their face, their chest, back and thighs. It is caused by sweat glands becoming blocked, so people usually get the rash if they're sweating more than usual. Heat rash isn't serious. It will usually go away after a few days, so it doesn't normally need medical attention. There are 4 signs of heat rash to look for: itching, a rash of tiny red spots, mild swelling, and a prickling or burning feeling. If someone has heat rash, you should explain that the rash is not serious, but give them tips on how to soothe the itching and avoid getting the heat rash in the future. You can suggest they take a cold bath or shower to cool their skin and help prevent further sweating. They can also buy calamine lotion or hydrocortisone cream, which will help to soothe the itching. Recommend that they wear loose clothing made of cotton, as cotton doesn't trap heat as much as synthetic fibers like nylon and polyester. Tell them to drink plenty of water to stop them getting dehydrated, and suggest they avoid excessive heat or humidity by staying out of the sun and not sitting too close to a fire or heater. So remember, when treating heat rash, suggest a cold bath or shower, use calamine lotion, suggest loose clothing, and drink plenty of water. And that's how you treat heat rash.
Stroke is caused by the failure of the thermostat in the brain, which regulates the body's temperature. If someone has a high fever or has been in the heat for a long period of time, the body can become dangerously overheated. Heat stroke can develop from someone who is already suffering from heat exhaustion. Heat stroke can develop quickly with little warning, and the casualty could become unresponsive within a few minutes. Our priority is to try and cool them down as quickly as possible and get them to hospital, as this can be life-threatening. If someone has heat stroke, you may see some of the following signs: hot, flushed and dry skin, restlessness and confusion, a headache, dizziness or discomfort, a bounding pulse and high temperature above 40 degrees, or their level of response may decrease rapidly. If someone has heat stroke, move them to a cool area quickly and remove their outer clothing where possible. Call 999 or 112 for emergency help. Help sit them down and wrap them in a cold, wet sheet. Pour water on the sheet to keep it wet until their temperature falls below 37.5 degrees. You can measure this with a thermometer under the armpit. If there's no sheet, you could sponge them with cold water or fan them to keep them cool. When their temperature returns to normal, replace the wet sheet with a dry sheet. While waiting for help to arrive, monitor their level of response. If their temperature starts to rise again, repeat the process to try and cool them down. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, when treating heat stroke, move them to a cool place and remove clothing where possible. Call 999 or 112 for emergency help. Wrap them in a cold, wet sheet until their temperature drops, and monitor their level of response. And that's how you treat someone with heat stroke. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk.
Hyperventilating is excessive breathing. It's normally caused by extreme anxiety and can happen at the same time as a panic attack. When someone is hyperventilating, they breathe unnaturally fast and deep, which can make them lose more carbon dioxide from their blood than usual. This can make them feel dizzy and weak. When they start to breathe normally again, they should feel better. There are 6 signs to look for if you think someone is hyperventilating: unnatural, fast, deep breathing, anxiety or attention-seeking behaviour, feeling dizzy or faint, trembling or tingling in the hands or feet, and muscle cramps in the hands or feet. If someone is hyperventilating, talk to them and reassure them. Try to take them somewhere quiet. This will help them to control their breathing. If that's not possible, ask any surrounding people to leave or turn away. Once they have controlled their breathing, advise them to see a doctor as to how they can prevent and control hyperventilation in the future. If you are concerned about their symptoms or if their breathing does not get any better, call for an ambulance. So remember, if someone is hyperventilating, take them somewhere quiet. Ask other people to turn away or leave and encourage them to see a doctor.
Your priority is to control the bleed and keep the airway open. Help them to sit down, never lie down, and keep the nose above the heart to help to control the bleeding. Get them to lean forward, never backwards. This ensures that the blood drains out through the nose rather than the back of the throat, which may block the airway. Ask the casualty to breathe through their mouth and pinch the soft part of the nose. You can give them a pad to catch any blood that may drain out. After 10 minutes, release the pressure. Reassess. If the bleeding has not stopped, apply the pressure for a further 10 minutes. If the bleeding is severe, or if you have not managed to control the bleed after 30 minutes, it is time to call for an ambulance. So remember, get them to sit down, leaning forward. Pinch the soft part of the nose. And if necessary, call for an ambulance. And that's how you treat a nosebleed.
There's something wrong with your baby. If you know what to do, you'll give them the best chance of survival. If something has happened to your baby, you'll need to do a primary survey. This is a quick, orderly way for you to find out if your baby has any injuries or conditions that are life-threatening. You should always perform a primary survey before treating your baby because it will help you find out what's wrong and the best way to help them. We can use the initials DRABC or Dr. ABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. To perform a primary survey, first you need to ensure there's no danger. That means nothing near the baby that may cause further harm to them or to you. This is to avoid any injury to you and to prevent you from becoming a casualty as well. Look around quickly and make sure it's safe to approach. If you see any danger or anything hazardous nearby, clear it away quickly. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is not breathing normally, ask a helper to call 999 or 112 for emergency help. If you're on your own, use a mobile on speakerphone so that you can start CPR as soon as possible. If you don't have a speakerphone, begin CPR for 1 minute before making the call yourself. If your baby is breathing normally, check to see if they are bleeding. This will enable you to stop blood loss from the circulation. Try to treat and control any severe bleeding. If your baby is not bleeding severely, place your baby in the recovery position. Just cradle the baby towards you in your arms with their head tilted downwards. This will help keep your baby's airway clear and prevent them from inhaling any vomit. Keep monitoring their breathing until help arrives. If they stop breathing, open their airway and start CPR. So remember, do a primary survey to try and find out what's wrong as quickly as possible. We do this by checking for danger, check for a response, open their airway and check their breathing. If they aren't breathing, call for help, ask a helper to dial 999 or 112 for emergency help and begin CPR. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. If they are breathing normally, check their circulation, check for severe bleeding and treat if necessary. If there is no severe bleeding, hold them in the recovery position until help arrives. If they stop breathing, open their airway and begin CPR. And that's how you perform primary survey on a baby.
When bleeding
Thanks
is
for
severe,
watching.
it can
Help
be
support
dramatic
syndrome
and
ambulance.
distressing. If someone's bleeding isn't controlled quickly, they may develop a life-threatening condition called shock, and they may become unresponsive. Bleeding from the mouth or nose may affect their breathing, so try to ensure that the airway is kept clear. An obstructed airway can be a cause for a casualty to become unresponsive. If the casualty becomes unresponsive at any point, open the airway and check their breathing and prepare to treat an unresponsive casualty. To treat someone with a severe bleed, put gloves on if you have them, as this will help to protect you both from infection. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it in and apply pressure on either side of it to push the edges together. If there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Jenny, can you apply some pressure for me, please? Brilliant, excellent, well done. Ask a helper to call 999 or 112 for emergency help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. The casualty may develop shock, so help them to lie down on a blanket or rug if there's one to protect them from the cold. Raise and support their legs so they are above the level of their heart. Do not raise the leg if it is injured. Jenny, could I lay you down? Excellent. Just going to lift your legs up. Is that okay? Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. So I'm just going to apply this dressing to the bleed. Okay. Want to take your hand away? Well done. Okay. Can you hold that for me? Excellent. Okay, could I have this? Okay. Check the circulation by pressing a nail bed or skin beyond the bandage for 5 seconds. Release the pressure. And if the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. Okay, can I have this? Lovely. Okay, excellent. If blood shows through both dressings, remove them and apply a fresh bandage, ensuring there is direct pressure applied at the point of bleeding. Support the injured part with a sling or bandage, but check circulation every 10 minutes. Keep monitoring the casualty's level of response while waiting for help to arrive. So remember, when treating severe bleeding, wear gloves if available. Remove or cut away any clothing from around the wound. Check for objects in the wound, but don't remove them. Apply pressure on either side of the wound. If there is no object in the wound, use a dressing or pad and apply direct pressure to the wound. Call 999 or 112 for emergency help. Secure the dressing with a bandage. Treat the casualty for shock. Support the injured area. Keep checking their level of response while waiting for help. And that's how we treat someone with a severe bleed. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
Shock is a serious life-threatening condition that happens when vital organs in the body are not getting enough blood flow, and this can lead to failure of these organs and the heart. Shock can be caused by anything that reduces the circulation or blood flow, such as severe bleeding, which you may be able to see, or it may be hidden and internal. If the heart is unable to pump blood around the body after problems like a heart attack, severe heart disease, or heart failure. Loss of bodily fluid following severe vomiting, diarrhea, or severe burns. After a severe allergic reaction or severe infection. And following a spinal cord injury. These conditions may all lead to life-threatening shock. When someone is in shock, they may have a fast pulse, pale, cold or clammy skin, sweating, fast, shallow breathing, grey-blue skin, especially inside the lips, weakness and dizziness, nausea and possible vomiting, thirst. As the shock becomes more severe, they may have a weak pulse that you may not be able to feel, restless and aggressive behaviour, gasping for air, they may become unresponsive. To treat for shock, you need to try to reverse the cause of shock. If you find severe bleeding or serious burns, try to treat these whilst reassuring the casualty. Help the casualty to lie down. If possible, try to lie them down on a rug or blanket, as this will help protect them from the cold. Raise and support their legs above the level of their heart, as this will increase blood flow to the head and vital organs. But if the casualty has an injured leg, do not raise it. If the casualty is pregnant, help them to lie with their body leaning towards their left side to prevent obstruction of blood flow returning to the heart. If you haven't done so already, call 999 or 112 and tell ambulance control that you suspect shock. Once you have called for emergency help, you can then loosen any tight clothing around their neck, chest and waist. Stay with the casualty and keep them warm by covering them with a blanket or coats. Try to reassure them and keep them calm. Keep monitoring their level of response. If they become unresponsive, open their airway, check their breathing and prepare to treat someone who is unresponsive. So remember, if you think someone is in shock, treat the cause of shock. Lay them down and raise their legs. Call 999 or 112 for emergency help. Loosen any tight clothing and keep them warm and calm. Monitor their level of response. And that's how we treat shock. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
An AED is a life-saving device that can give your heart an electric shock when it has stopped in a cardiac arrest. AED is short for Automated External Defibrillator. An AED can be used on adults and children over 1 year old. Using an AED in crucial minutes before an ambulance arrives can increase someone's chance of survival. Anyone can use an AED. You don't need to be worried about getting it wrong or causing harm because the machine analyzes the casualty's heart's rhythm and then gives visual or voice prompts to guide you through each step. If someone is unresponsive and not breathing normally, ask someone to call 999 or 112 for emergency help. Ask them to bring an AED if one is available. If you're alone, make the emergency call yourself on a mobile phone or speakerphone and start CPR with chest compressions. Do not leave the casualty to look for an AED. Keep doing CPR until someone brings an AED. As soon as the AED arrives, ask for it to be switched on while CPR is continued. It will immediately start to give you a series of visual and verbal prompts informing you of what needs to be done. If someone is with you, ask them to follow the instructions until emergency help arrives.
Call for help now. Remove all clothing from patient's chest. Pull red handle to open bag. Look at pictures on pads. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Evaluating heart rhythm.
Stop compression, Susan. Stand back.
Stand by.
Stand clear, everyone.
Shock. Everyone clear. Do not touch patient.
Stand back.
Delivering shock. Shock delivered. Provide chest compressions and rescue breaths.
The AED will instruct you to continue CPR for 2 minutes before it reanalyzes. The AED could say no shock advised, continue CPR. If the casualty shows signs of becoming responsive, place them in the recovery position. Leave the AED attached. Continue to follow the voice and or visual prompts that the machine gives you until help arrives. So remember, when using an AED, call 999 or 112 for emergency help. Continue giving CPR when the AED arrives and keeps going while the pads are applied, if possible. Ensure that the pads are placed on the chest after clothing has been cleared or cut away. Ask for the AED to be switched on and follow the instructions. Ask people to stand back when the AED is analyzing and when any shocks are being delivered. And that's how you use an AED. If this video has been helpful to you, help support St. John Ambulance by going to
In an emergency situation, you may need to act quickly, so it's important that you're familiar with your first aid kit to know what to use for different injuries. All workplaces, leisure centres, homes and cars should have a first aid kit. Plasters for small cuts and grazes. A wound dressing is a sterile pad attached to a bandage. They're for larger cuts to apply pressure and stop the bleeding. They're easy and quick to apply in an emergency. Roller bandages are long, thin bandages rolled up. They're used to hold dressings in place, to apply pressure and stop bleeding. You can also use them to hold ice packs in place to reduce the swelling. A triangular bandage is a large triangular-shaped piece of cloth. It can be used as a bandage. Also, it can be used as a dressing if it's sterile, to cover a large wound or burn. Disposable gloves reduce the risk of infection between you and the casualty. Always wear them if you have them when dressing a wound. Also use them when dealing with any bodily fluid or waste. Face shields or pocket masks can be used to reduce infection when giving rescue breaths. Alcohol-free cleansing wipes are used to clean the skin around the wound. Gauze swabs can be used as dressings, padding or swabs to clean around the wound. Sticky or adhesive tape is used to hold dressings in place or to secure the loose ends of bandages. Scissors are used to cut somebody's clothing so that you can get to the wound. They can also be used to cut sticky tape to the required length. Some other common items that might be useful are cling film or clean plastic bags for dressing burns and scalds. Use alcohol gel to clean your hands if you don't have any water. A blanket, survival bag, torch and whistle are useful for helping people outdoors. A warning triangle and a high visibility jacket are useful in the car for dealing with road accidents. So remember, make sure you have a first aid kit and make sure you know how to use it.
Out of its usual position. Injuries of this type include a pulled elbow. This can happen if an arm is pulled with too much force, when pulling your baby up by the hands or pulling an arm through a sleeve while dressing. If your baby has a dislocated joint, you might see some of these signs. They may have pain in the area. They may not be able to move the joint as usual. The area might be bruised or swollen or look misshapen. If you think your baby has a dislocated joint, try to keep them still. Don't try to put the dislocated bone back into its socket, as this can cause further injury. Steady and support the limb and use padding to keep the injury supported. Call 999 or 112 for emergency help, or take the baby to see a doctor or nurse or to hospital. Treat them for shock if necessary. While you wait for the ambulance, check your baby's breathing, pulse and whether they can respond to you. So remember, keep your baby still. Don't try to put the joint back into the right place. Pad and support the injury. Call 999 or 112. Keep checking pulse and breathing while waiting for the ambulance. And that's how you treat a baby with a dislocated joint. Thanks for watching. Help support St John Ambulance. Donate.
Babies and toddlers can push objects into their ears or nose quite often, and sometimes insects may fly or crawl into the ear. If they have an object lodged in their ear or nose, do not try to remove it yourself, as you may push it in further or cause injury. If there is an object stuck in your baby's ear, take your baby to hospital as soon as possible. Keep reassuring them. If you think they have an insect in the ear, you could try to help it out by sitting them down and supporting their head with the affected ear facing up. Gently pour some tepid water into the ear and the insect should float out. If it doesn't, seek medical help. If there is an object stuck in the nose, try to keep calm. If possible, get them to breathe through their mouth and stop them from poking their nose. Take them to hospital so that the object can be safely removed. So remember, if your baby has something stuck in their ear or nose, don't try to remove the object yourself. Take them to hospital as soon as possible and help them to stay calm. If the object is stuck in their nose, encourage them to breathe through their mouth and don't let them poke their nose. If they have an insect in the ear, you could use warm water to try and flood it out. And that's how you treat a baby with an object in their ear or nose. Thanks for watching. Help support St John Ambulance. Donate today.
Although it can be very worrying to see your baby having a seizure, if it is dealt with properly, it is rarely dangerous. Your baby may have a seizure if they have a high temperature, which is sometimes caused by an infection. The electrical systems in a baby's brain are not developed enough to cope with a high temperature, and that is why they are more likely to have seizures. If your baby is having a seizure, you might see some of these signs. They may shake vigorously, arching their back and clenching their fists. They may have signs of fever, such as hot, flushed skin or sweating. Their face may twitch, and their eyes may be squinting or fixed or upturned. They may hold their breath and dribble with a red, puffy face and neck. They may vomit. They may wet themselves or soil themselves. They may not respond to you as usual. If you think your baby is having a seizure, you need to protect them from hurting themselves. Don't hold them down or restrain them, and don't try to move them. Just clear away any dangerous objects and put pillows or soft padding around them. When the seizure has stopped, take off any clothing that isn't needed, but take care they don't get cold. Put your baby into the recovery position and call 999 or 112 for an ambulance. Reassure your baby and keep them calm. While you wait for the ambulance, check your baby's breathing, pulse and whether they can respond to you. So remember, don't move or restrain your baby. Remove dangerous objects nearby and protect your baby with solid pulse and breathing while waiting for the ambulance. And that's how we treat a baby who's having a seizure. Thanks for watching. Help support St John Ambulance. Donate today. Sometimes our bodies come into contact with things that can cause an allergic reaction, which may cause a rash or sneezing. These may be uncomfortable but not life-threatening. However, a severe allergic reaction, which is also known as anaphylactic shock, can develop in seconds and needs to be treated quickly. Your baby may have a severe allergic reaction to some foods, such as nuts or animal hair, or even to some medicines. If your baby is having a severe allergic reaction, you might see some of these signs. They may get a red, itchy, raised rash. Their eyes may be itchy and watery. Their face or lips may swell up. They may vomit or have diarrhea. They may become wheezy or find it difficult to breathe. They may either be very pale or very flushed, and they may become very upset. If you think your baby is having a severe allergic reaction, you need to get help as soon as possible. Dial 999 or 112 straight away. Tell them that you think your baby is having a severe allergic reaction and what might have caused it. Sit your baby on your lap and lean them forward slightly to help their breathing while you're waiting for help. If you already know what your baby is allergic to and your doctor has prescribed medication to treat an allergic reaction, like an EpiPen, give them the medication in the usual way, like your doctor has told you. If you think they are in shock, lie them down and raise their legs. If your baby is unresponsive, if they are not moving or making a sound and they are not breathing normally, you will need to give them CPR. So remember, call 999 or 112. Give allergy medicine if you have it. Sit your baby on your lap and lean them forwards to help with their breathing. If your baby is unresponsive and not breathing normally, start CPR. And that's how we treat a baby with a severe allergic reaction. Thanks for watching. Help support St John Ambulance. Donate today.